Hi. I also just wanted to acknowledge that we're meeting on Aboriginal land today and pay my respects to the elders past and present of that land. So I'm Catherine Wood and I'm the Cancer Coordinator of the Aboriginal Health and Medical Research Council, which is the peak body for Aboriginal health in New South Wales, and we represent our members who are the AMSs of New South Wales. And I was just going to talk a bit about the work that we're doing around cancer in New South Wales. A bit of background, the AH&MRC received funding in 2012 to partner with the Cancer Institute of New South Wales, which is the New South Wales State Government Cancer Agency, and the Cancer Council of New South Wales, which is obviously an NGO, to work on a 3-year project called the Aboriginal Cancer Partnership Project. And the general aim of that project is to improve cancer care and outcomes by improving cancer awareness in the community and the knowledge of the health professionals who work with the community. And there are several elements to this project. I'm going to talk a little bit about the training needs analysis today, which was one of the first things we did, and an investigation into the current level of knowledge and gaps in those knowledge of different kinds of health professionals. We're also doing community awareness raising workshops, which are local workshops that bring together community members and health workers to talk about cancer and to talk about the issues and barriers that Aboriginal people face and some solutions to those. We've also done advocacy or community action training, which was about giving Aboriginal people the skills to change the policies and laws and systems that can affect cancer outcomes. So that's things like lobbying politicians and working with the media and influencing decision makers. And then we're also developing a cancer awareness module at the Aboriginal Health College in Sydney, which is our RTO and kind of similar to Tracy and Carmel's modules. So the training needs analysis was our foundational piece. So we just sort of, before we started developing any of the others, we wanted to check what people themselves felt they needed to know more about and what are the roles of different health professionals who provide cancer care to Aboriginal people. And what do they feel themselves that they needed to learn more about so that they can be confident that they're providing the best care. And we did that by looking at the needs of the staff who work in AMSs, as well as the Aboriginal staff who work in hospitals, mostly the ALOs and the AHEOs, and also the mainstream cancer services staff and the specialists and doctors there. So we commissioned a consultancy in 2013 to conduct in-depth interviews with workers. They conducted 53 in urban, remote and rural regions around New South Wales. And these included about half were from AMSs, and they were Aboriginal health workers and nurses, but also managers, CEOs, GPs, transport, admin. And then sort of a quarter of the rest were Aboriginal identified positions in hospitals, and then the other quarter were the mainstream cancer services staff. And I guess we invited services to identify for themselves who they thought the main people in their service were that provided cancer care to Aboriginal people, and it was really interesting to see how many non-clinical staff put up their hand and said that they feel like they played a key role and that they needed to know more about cancer, and that included the transport drivers and the receptionists and admin staff, who I guess are kind of front line with clients. And I guess this reminds us that training opportunities for cancer could be valuable if they were open to all, and not just limited to nurses or health workers and clinical positions, and that's the way that cancer knowledge and information can be passed on to clients, and general awareness about cancer can be improved. So I'm not sure where I'm going with the slides. What do we find out? So when we asked the AMSs what they saw as their key role in providing cancer care, they said currently around cancer prevention and the promotion of healthy lifestyles, promoting and facilitating screening, practical assistance and helping people get to screening and treatment, so transport and financial assistance, social and emotional support for family, helping explain to patients what was going on and helping them prepare and know what to expect. And only limited stages, limited input at this point around recovery and follow-up and survivorship and palliative care. So basically they said that they feel that they should be playing a role throughout the whole of a patient's cancer journey. And then we asked, well, where are the gaps in your knowledge and how confident are you along those different parts of the journey? And basically they said, we really need to know more about everything. We found that the base level of knowledge of cancer for most of the workers was quite low, and there was still a lot of myths and misconception and fear of cancer even among the workers. And obviously a lot more knowledge was needed to clarify what cancer is and isn't and what happens if you get it. So while the AMS staff really felt very confident in their knowledge of other chronic diseases, they felt that cancer was really different. It's a much more sensitive issue and it's much more complex and confusing, and unlike the other chronic diseases, there was main problem was there was a lack of a clear path to support somebody once they're diagnosed. The network of different services is very confusing. There's a lot, it's very overwhelming, and the process for referring and the criteria for referring is quite difficult to understand and access. Obviously another apparent difference was the way treatment is carried out in a tertiary setting, and the current lack of collaboration between hospitals and AMSs meant that while an AMS might be looking after a person up to the point when they're diagnosed, sending them off for tests, then they're kind of lost in the hospital system a bit, and the AMS staff are not really sure where they're up to and what kind of support they need. So they say that if they had a clear understanding of all of the different stages of the journey, including treatment and beyond, even though they don't administer treatment, they would be able to play a much stronger role in being a patient advocate and helping a patient know what their options are. So we asked specifically, what training do you want and what do you need to know about? They said more awareness of risk factors and signs and symptoms to promote that early detection we've been talking about. More detailed knowledge of the screening programs, like who exactly and at what age and how often and how do we do it. Particularly confusion around bowel screening. I think people have much more understanding of breast and cervical screening at this stage, so I think there's an opportunity for more work there. Better overall knowledge of cancer treatments and the process and the pathway and side effects, so that when their clients are worried and asking questions, they can at least provide some answers and reassurance about that. And improved knowledge of the hospital system and the different support services that are available. We know there's people who can do financial assistance and transport and accommodation, but just who are they and how do you find them? And a kind of clearer delineation of responsibilities between an AMS and a mainstream services in supporting the clients, and how to work better in partnership to make sure that all needs are seamlessly met along the journey. There was also mention of understanding about the use of traditional and complementary therapies and whether these are supported or not, and more understanding of palliative care. So we asked as well, how would you like to receive the training? What's the most effective way? Overwhelmingly they said face-to-face, that's probably not surprising. And regular and continued. While one-off is better than nothing, it's a lot to learn, and you need to be building this knowledge over time. And really interestingly, people in AMSs that we talked to said that there was a preference for trainers who had technical skill and knowledge in cancer and could answer any tricky questions that they had, rather than trainers who were Aboriginal themselves, or I guess co-presenting would be a good way to do it. And informal learning opportunities like workshops and site exchange programs, where might go and visit the hospital and that sort of thing, was really supported. E-learning not highly encouraged at that time because a lot of services don't have computer access or very strong internet connections, but there could be opportunities there as well. And when we compared that with the results in the hospital cancer services, the needs of the Aboriginal identified staff were pretty much the same as the AMS staff. They said they generally want more understanding of across the spectrum from prevention, screening, treatment to what happens afterwards and what services are available. But for the non-Aboriginal staff, such as the nurses and the doctors and the cancer specialists, they said that rather than clinical knowledge, they really do need to know a lot more about cultural competency and be more confident in communicating with Aboriginal people. And while most people had completed some kind of cultural awareness training, most of it felt that this was insufficient. I think they had done half an hour online module, and that wasn't really enough to understand. Is that a yeah? Okay, 5 minutes. So basically they just wanted to understand more about the barriers that Aboriginal people face and the context and the situation they're coming from, and some awareness of the differences in outcomes for Aboriginal people, so the stats and the data and the evidence that we kind of saw this morning. And some practical tips about what to say, what not to say, although everybody's different, so that would be kind of tricky. But I think it was important outcome to be reminded that mainstream staff really did feel like they wanted a lot more training and that they were interested and willing to change and adapt their practice if they knew how. So just quickly a little bit about what we've done with the results. So we've used this training needs analysis to inform the later parts of our project. And we've developed some training opportunities to address the needs of both the Aboriginal workforce and the mainstream cancer workforce. And one of the main ways we're doing this is through yarning about cancer workshops, which are local workshops. We've held 10 over the last year, and we have at least another 10 planned for this year. And that in each one there's 30 to 50 Aboriginal health workers brought together with Medicare locals, staff from the hospitals, cancer services, Cancer Council and support services, provide knowledge about cancer along the pathway, meet the people who work in the hospital, meet the people who work in the support services, build those relationships, talk about the local issues and the barriers specific to that area, and then we'll start to work together on some local solutions. And then a key outcome of those is that a local network is being formed in each place to work on these solutions ongoing. So basically the focus is on building relationships and the idea that one health worker doesn't need to know everything about all cancers and all cancer treatments. They just need to know who to call if somebody they know gets cancer. And then we've learned a lot through these workshops as well about all the other things that people need in addition to training and knowledge to improve cancer awareness. Because we have brought together over 300 Aboriginal people through these workshops, so it's quite a big community consultation, and we've got some really strong themes that have come up every single time. And some of them are, the patients are all saying they need localised cancer resources, patient information kits, that sort of thing. The workers want local service directories and contact lists of services locally. Local cancer ambassadors, so they're the elders and the survivors to just be telling their stories and speaking out. Local Aboriginal cancer support groups to share information and support. Having more Aboriginal people in cancer health promotion and ads. And encouraging mainstream services to be more proactive in promoting themselves, so calling up the AMS, inviting themselves along to NAIDOC days or community days. And the biggie, which I guess we've been talking about all day, is the need for more dedicated Aboriginal cancer workers. So basically that's where we're up to at the moment. We think we've still got a long way to go, but as Gail was saying this morning, I think in the last couple of years there's been a lot of progress in terms of bringing people together and starting those networks, so it's exciting to see there's some outcomes already. That's me. Thanks.